Hi, my name is Brenda Lorentz, and my review for the University of North Dakota College of Nursing and Professional Disciplines independent study is on screening for Barrett's esophagus to decrease mortality of esophageal adenocarcinoma. There are two different forms of esophageal cancer, and the most common, 80% of cases in the United States, is adenocarcinoma. This cancer forms in the lining of the distal esophagus in the glandular cells and is linked to Barrett's esophagus, with GERD being a major risk factor. There are no preventative screenings for esophageal cancer, and with it being the sixth leading cause of cancer-related death, with a 5-year survival rate of less than 25%, there is a need for screening measures. Esophageal cancer is usually diagnosed at later stages when it has already spread to surrounding tissue or other organs or tissues that are away from the primary tumor. This is shown with limited symptoms until later stages when the tumor is larger and there is trouble with swallowing, weight loss, or coughing or vomiting blood. So a way to decrease mortality from esophageal cancer is to diagnose it in an earlier localized stage. The purpose of this review is to identify if there is a decrease in mortality from esophageal cancer by screening with an EGD in people with chronic GERD versus the usual treatment of only medication management. The literature review from 3 databases with a total of 17 articles was reviewed, including 6 articles obtained from CINAHL Ultimate, 7 articles from Academic Search Ultimate, and 4 from PubMed. Barrett's esophagus goes from non-dysplastic to precancerous state of low-grade dysplasia to high-grade dysplasia, and then to cancer, esophageal adenocarcinoma. It is not cost-effective to screen every single person with an EGD, a scope that goes down the throat to look at the esophagus and stomach with a camera. Right now, EGD screening is the primary tool and the gold standard for diagnosing. During the review, I found that there are many different angles to esophageal adenocarcinoma. A major risk factor is GERD, and there is a link between reflex symptoms and longer Barrett's esophagus, which is more likely to progress to cancer. But GERD is not always present with adenocarcinoma, and actually 40% of patients diagnosed with esophageal adenocarcinoma deny GERD symptoms. Risk factors for esophageal adenocarcinoma include male, older age, Caucasian, low level of education, high BMI, cigarette smoking, GERD, family history, and obstructive sleep apnea. As of right now, the American Gastroenterological Association has recommendations that screening should be considered with individuals who have chronic GERD and at least 3 risk factors. There are risk stratified screening tools to try and assist if there should be an EGD screening on patients that are at highest risk, but none have been proven to be the preferred screening method. And as of right now, PPIs have shown effective against GERD, but results are mixed on their effectiveness against adenocarcinoma or on Barrett's esophagus progressing to adenocarcinoma. The review has shown that routine screenings for chronic GERD symptoms without additional risk factors are not supported because, for one, not all people always have GERD symptoms with Barrett's esophagus or adenocarcinoma. During the review, having a family history of Barrett's esophagus and a history of esophageal adenocarcinoma places a person at greater risk and plays a larger role than previously thought. There is no one universal definition for chronic GERD, making it difficult to classify people into this category. The current recommendations should be followed, which include screening people with chronic GERD and 3 additional risk factors. A potential screening opportunity includes people who are already having a colonoscopy, and a good time to have a conversation is when the provider is refilling GERD medications. Future needed research is the role of PPIs and Barrett's esophagus, and if it prevents cancer, less invasive screening procedures, effective risk stratified screening tools, and Barrett's esophagus progression to cancer. And then these are my references. Thank you.